Hi, everyone. For millions of people living with celiac disease, diagnosis and monitoring can be difficult, especially once gluten is removed from the diet. I'm Renu Dhanashekaran. I will be talking to our Professor Dr. Nielsen Fernandez-Becker. She's leading a clinical and research program for patients with celiac disease at Stanford. Hi, Dr. Fernandez-Becker. Could you please start by explaining to us what celiac disease is in simple terms?
Great. Thank you for inviting me. So celiac disease is an autoimmune condition where the body reacts to gluten, which is a storage protein in wheat, barley, and rye. And every time somebody with celiac disease eats gluten, it triggers inflammation in the small intestine and injury to the mucosal surface. And this results in symptoms, including bloating and also extraintestinal symptoms like anemia and osteopenia. And over time, repeated exposure of gluten causes injury to the lining, making it harder to absorb nutrients.
Okay, got it. Why is diagnosing celiac disease challenging, especially if patients are on gluten-free diet? Is that a bigger challenge?
Absolutely. So we are lucky in that we have very good screening tests that are highly sensitive and specific. And by that, I mean tissue transglutaminase and deaminated gliadin peptide. However, many people will adopt a gluten-free diet before the diagnosis is made. And this makes it very challenging because the antibodies are cleared by the bloodstream, so we struggle to make the diagnosis. And we really need specific tools that we can make an accurate diagnosis, particularly in situations like that.
Oh, got it. That brings me to my next question. I was reading about a clinical trial with something called HB2121. Can you tell us more about it?
Sure. So the standard of care right now is if somebody is on a gluten-free diet, we tell them go back on gluten. And which sounds crazy, right? Because if I diagnose somebody with celiac disease, I tell them gluten is a poison to you. And then I'm telling them, well, can you eat this poison so I could tell you that you have the disease? So there's a big impetus towards trying to develop tools that we can use to definitively make the diagnosis. And HB2121 is a molecule that was developed here at Stanford in the laboratory of Dr. Chetan Khosla, who is a chemical engineer. And basically, it's designed to bind the protein tissue transglutaminase, which is the autoantigen in celiac disease. And we know from previous studies that it exists in an active conformation in patients with celiac disease, but not in people who don't have celiac disease. So it also it's a small molecule that binds tissue transglutaminase, and it's also linked to a fluorescent molecule. So we are able to see that with immunofluorescence. So basically, it lights up the lining of patients who have celiac disease. And from our animal studies and also stains that we've done in patient biopsies, um, it really, we think that it has the potential of really distinguishing somebody who has active celiac disease from people who don't have celiac disease. And it may even have the potential to tell us, to give us the diagnosis in somebody who's already on a gluten-free diet and allow us to monitor the disease activity over time because we don't have any tools for that now.
Oh, yeah, that sounds really cool. So, can you tell us more about the clinical program for celiac disease at Stanford and how it supports patients with this diagnosis?
Sure. So at Stanford, we see a very wide spectrum. Patients who are suspected to have celiac disease and also complex cases, particularly refractory celiac disease. Unfortunately, the gluten-free diet is not effective in everybody, and there are conditions that can complicate celiac disease. There could be concomitant conditions like microscopic colitis, small intestinal bacterial overgrowth, but there could also be very aggressive forms of celiac disease where the inflammation persists despite being on a very high quality gluten-free diet. And this is what we call refractory celiac disease. And a subset of those individuals are at very high risk for developing lymphoma. So early detection is important, and we welcome referrals of any patients that are not responding to the gluten-free diet as appropriately as we would want.
Thank you so much. Truly a bench to bedside program here at Stanford. Thank you. Have a nice day.